Good morning, and I respectfully acknowledge that I live, work, and play on the unceded territories of the Coast Salish nations, including the homelands of the Squamish, Musqueam, and Tsleil-Waututh. So thank you everybody for joining me for my talk today on music and wellness. So as a music therapist, I have witnessed several ways in which music has positively impacted mental health. I'm going to share with you today some of the work that I do, what a music therapy session might look like, and also what have been some of my patients' responses. And I'd also like to share with you how music can be a strong intervention for mental wellness. Furthermore, this all can be translated to how music can actually be used as an effective coping strategy during this time of isolation, particularly. Many of the folks that I work with suffer with anxiety, depression, psychosis, and anyone who has experienced anxiety personally or through a loved one will know how uncomfortable those feelings of nervousness, tension, and that sense of panic or doom can affect one's daily life. Folks with depression or psychosis struggle with making decisions, concentrating, feeling mentally organized, and that's only to name a few. So as a therapist, and most of the work that I do, the most important aspect, I will say right now, is that I form a relationship with the patient, and then providing the structured framework in the program that will address non-musical goals, but in a musical way. So I may have someone who is in need of, self-regulation, someone who is having trouble with making decisions, someone who just becomes very overwhelmed with the tasks of daily life. And through the use of music, we may have a little improvisation using some drums, and we will do an exchange, like a musical exchange of the drums. I don't know if you can see behind me here, I have quite a large drum. It is it's actually a Celtic bowran. And in it, you can see there's circles. I hope you can see it. There's circles, and there's a green dot in the middle. We use a lot of that for boundaries, and they're all in the name of a game, right? So, we'll have like the mallets that are quite large, and, we'll tap to a pattern or connect with somebody, and stay in your own lane, stay in your own zone, boundaries, and it can actually turn out to be a lot of fun. But, those conversations, just from a little tapping of a drum or a little exercise like that, could lead to a lot of conversation about, using boundaries, how to not feel overwhelmed when something is coming your way, how to just ground yourself and just let yourself think for a moment. Now, of course, right now, that drum has been sitting there for a long time because I have not been able to use it because of the safe distancing that we've had to enforce. So, but it has been a very good tool. So that's a non-musical intervention, a non-musical goal with a musical intervention. So I know we're here to talk about using music at home, but when the people are in the hospital, they may come from a source of isolation, but they manage to socialize and connect with others. And a lot of what we do is to help them get back out into the community and follow a healthy path. And that means coping skills, that means socializing, that means, regulating yourself with amongst others. And so these music therapy sessions do have opportunities to share and socialize and connect with their co-patients. So inside the hospital, they have the opportunity to do that. So a lot of the groups that I do, as I have explained to you, is that I shape my session. A lot of what I do is shaped around the patient's needs. So what you might see, as I just said, you might see a lot of people playing drums, playing singing and instruments, and hopefully some smiles as well. But what's happening is that the opportunities are there for creative and healthy expression, and they're being formed, which in turn can increase their motivation, their self-esteem, as well as, work on maybe gaining some insight into themselves. So through the past year, as we all know, there's been a strong need for connectivity and ways to cope when the days get very difficult. And to this end, as a therapist, I use music in a purposeful way in order to increase the self-awareness and to decrease and to be okay with isolation, because there's a difference between feeling isolated and being happy with being alone. And a lot of folks sometimes struggle with being alone. Many of us have had that experience. So the greatest healer that I find, actually the greatest healer that we know is and a calming agent, is actually keeping the focus on the here and now, engaging in that moment and putting aside negative and intrusive thoughts, even for just 5 minutes or an hour, or whatever that person's focus and attention will give you in that given moment will allow. So one of the changes is that I observe is the length of time that a person can attend to a group session or participate in the tasks that are presented in that session. Medication has a strong role, of course, and music is a wonderful gauge of that progress. So for persons living with depression, music can be uplifting, provide them with moments of openness and the ability to be part of a one-to-one or a group session. In several cases, folks that struggle with depression have a very hard time actually, making the decision to come to a group, even just being part of a group. Depression can just weigh us down in ways that if you've not ever known it, we can't understand. But I've seen it, and I can see the help that music can provide, even in the sense of just listening, just being with the group. They don't have to say a word, just being with the group. And I see progress. They'll come again to the group because it's a safe place, non-judgmental, and that person can sit for an hour without saying a word. But oftentimes, I will tell you, they will say a word. They will talk, they will engage, and they might even just have a book that they'll like to follow the words to, the lyrics. And all of that actually just lifts that weight from them, from what they have told me. So I also work with adults with complex disorders who demonstrate behaviors of psychological symptoms of dementia and advanced dementia. And these folks are particularly soothed by music. The psychosis, the depression, the apathy, the mood syndromes, aggression, agitation, all of those, and a variety of other inappropriate behaviors can be decreased when the person is attending to music. In the tertiary care unit that I worked with the elders, I would spend the whole day simply playing music. And times my students or my interns would say, well, what are we accomplishing here? And I would say, well, they're still sitting here, they're still listening, they're awake, someone's just barely tapping a foot, they're engaged, rather than feeling that confusion of where they are, they want to go home. It is a strong intervention. So I use receptive listening a lot with a lot of complex disorders. I try not to put too much pressure on, them interacting or, giving me feedback, and, and it just helps them to really just maintain that here and now orientation that I mentioned before. I mean, it's just, there's no past, there's no future. It's just right here and right now, keeping the person focused on the present music that is playing. Now, in the more advanced stages of dementia, music can be actually far-reaching into various parts of the brain, as studies have shown that when through the fMRIs and MRIs, brain scans, that when you play music, like all parts of the brain light up. We've seen so many studies or demonstrations of that, and they help the person connect with memories that go far back into their past, and they'll start interacting by singing along to their favorite songs from way back. So music is a wonderful modality and can greatly improve one's life, not only for the patient, but also for the family who's caring for them. And in this past year, I've known several families who have wanted to keep their elderly patients at home to keep them safe. And using music can reduce the agitation and thereby reduce the episodes of aggression. So I want to share with you some testimonials of patients with whom I have worked, their stories of once they left the hospital, or even just as they've been in the hospital going through their treatment. Now, I met a woman who suffered with depression at the same time each year as a reminder of the loss of her son. She found comfort in playing along with music by purchasing her own wooden spoons. And she loved them. I use these spoons for so many different things. I don't know if anyone is familiar with this type of instrument. I don't know if you can see it. There we go. Yes, I'm just playing it up here now. So they have a little bit of a tapping, and there's different ways you can use it as well. But they provided for this woman a certain level of grounding. When she came to my groups, first of all, she needed a lot of prompting. Secondly, to even leave her room. Secondly, when she came to the groups, she was very despondent and chose to be nonverbal, chose not to participate, would sit there because it was ordered by her doctor. So here we are with this group, and I was happy she was sitting there because I knew she could hear, and I knew she was engaged in listening anyway. So slowly, she reached over for one of these little spoons, and she said, "I want to try that." I said, "Okay," So I'm playing her song. She's tapping the spoons, and she said, "Where do I get one of those? Where can I get one of these?" I said, "Well, I can hook you up with one," and I did. Now, she was also undergoing a lot of other treatments, and she would take this spoon with her to all of her meetings or other treatments, or I don't know, there was something that she was really connected to. And one day I walked past her room, and there she was playing. I could hear this tapping in her room, and I knocked on her door and asked if I could join her or to come and visit for a moment. And she had her iPad on, tapping away. And what she told me later was that it grounded her. There was the tactile feeling, the aspect of holding these spoons while listening to some of her favorite music made her feel comfortable. And she also mentioned that it was some of her son's favorite music, and he was also a musician. So somehow it just connected her with something that she could hold and connect with her music. Another person that I know has found healing in his own music room, creating his own music room and resurrecting his previous skills of playing music from 2 or 3 decades ago. As a youngster, he played guitar, and when diagnosed with schizophrenia in early adulthood, he found it difficult to focus or attend to any tasks. So he put away his guitar and he just worked hard at his daily life tasks, which included staying very dedicated to his medication, because he was actually very afraid that he would relapse again and need hospital care. Now, years later, he's pulled out his guitar, he's picked up some used drums. Earlier, pre-pandemic, had invited a couple of friends to join in the ensemble, and of course, was starting to feel like he was regaining himself, is what he said. He sort of, "I'm finding myself again." And I know, and right now, because we can't play together in certain situations, he's still playing, albeit alone. But he says that engaging again and playing his music and just being with his guitar and his music, he feels actually saved him. So, and another story I have of a lady with a ukulele. She loved having one-to-one sessions and learning how to play a ukulele. And once her housing was confirmed, she went out and she bought herself one. And we heard back from the housing and her caseworker that she would practice that ukulele every day. And she passed a note on to me saying, "Thank you." And she loved the color of it because I had set her up with this ukulele. So they're wonderful, wonderful ways of hearing back. I mean, it's so rewarding for me to hear back that these folks are actually finding ways to engage in music in their own way, maybe resurrect music from the past, maybe start again, learning a new skill, learning a new instrument, in fact, is a wonderful way to engage your brain, wonderful way to engage your brain. And it really does build self-confidence and self-esteem as you accomplish and master certain skills, as we all know. So they found a way to connect with themselves, the grounding. And I mean, it does begin in the hospital, because that's where I work, and people do realize that the music is helping them. So right now, what I'd like to do is I'd like to have you join me for a little example of some fun, maybe. Going to play for you a few songs. So I'm just going to switch the energy a little bit here, because I was just wanting to sort of give you a little bit demonstration, one of the funner aspects of the music groups that we have, to get everybody involved. And I'm going to play for you some snippets of music, and I want you to see whether or not you can guess what the music is. So it's a little bit of name that tune, a little bit. And a little bit of just seeing if you recognize the music. And in our groups, we usually we will have everybody together, and it actually does lighten the mood in the group. So I'm going to play with you. Here's the first one. Fingers crossed. I hope everything comes through nicely. Here we go. Just a few seconds, okay? Familiar? If you know the name. So then we'll move on to, well, do you know the name of the song? Who's the artist? And here's another one right here. I'll give you a hint. Lotto Max. That's all the hint you're going to get. Sorry, I've got to. Any ideas? Here's the next one. Ready? Familiar? Maybe? And here is one that I loved because of a patient that I worked with, who had said to me that, I'll share a story in a moment, but he said that when he hears this song, it brings all the happy memories of his life back. Here we go. Do you ever feel like breaking down? Not that one. Sorry about that. See trees of green, red roses too. So that's just an idea, and this will last a whole hour. We will play, we will guess, and you know, at the moment, sometimes I'm getting some feedback. Yep, in the mood. Yep, you're right. It just engages everybody, even if they don't know the name or they don't know the artist. They'll be like, "What was that? What was that song?" You know. And I had a fella who had struggled with verbal skills, and I learned somewhere, you know, through his sessions, that he really loved Maroon 5. Yeah, Maroon 5. And I just put it on that day. Oh, he just featured, like, he was the star of the group that day. Everybody was so excited because we'd been having the group over and over, and he was not really engaging. He was trying, because of course he was very latent in his speech, and but when this song came on, he was just, yes, I know that song, right? His arms were up, he jumped up out of his chair. I mean, it was it was so encouraging. I loved it. It made me so excited. Yeah, not the Dance of the Sugar Plums, although I've had that one many times. That's what everybody thinks, I have to say. It's from the Peer Gynt Hall of the Mountain King. Sounds the same, kind of sounds the same. Listen to them both, you'll see the difference. So we could have arguments about, not arguments, but discussions like, yes, it is, no, it's not, it's the honey nut, you know. So you can see that the energy can actually really build in one of these groups, whereas, you know, maybe they came in very quietly and didn't know what to expect, a little vulnerable, you know. So I try to make the sessions fun, but really what I'm trying to do is get them to engage, get them to open up, get them to share, and that's helping to build the relationship. Eventually, we'll have one-to-ones and things can get a little deeper, and I work together with the allied health team in, you know, really preparing them to get back out into the community. So, and a lot of them will say, you know, I remembered my time here and I'm so happy and thank you, you know, and that just always warms my heart. Oh, so let me just, I got a little off track there because I got all excited with my own, my own music. So yes, let me get back to what I was saying. So, and so why is music so fun? Why do we have so much fun listening to music? Why do all of a sudden our brain feels better? Well, it's the chemical transmitters in our brain. We get feel-good hormones, you know. Music just boosts all those hormones, the dopamine, the serotonin, the endorphins, the oxytocin. You know, we have internal and external responses that are created, you know, like the internal feelings, the deep feelings that it might evoke, or you know, your heart rate, blood pressure, and of course your hormones, as I mentioned, and the external responses, you know, your tears, goosebumps, or the tingling that comes up in the back of your neck when you recognize a song. And research has shown that it boosts immunity. You know, stated that the cortisol hormone is actually decreased. It can decrease the stress hormone and help to actually maintain healthy immune function and boost it. Music has been known to be, people have said, has been better than drugs before surgery. It slows your heart rate, it reduces stress, and then it does enhance quality of life and promotes a speedier recovery. I know I had a surgery a few years ago, and I asked the surgeons if I could come in, if I could take my music with me, and they allowed me to bring it right just before the doors, of course. And they, you know, passed it over to my husband, and I did feel relaxed, although I don't know, I mean, there's a certain nervousness that goes with having surgery, but just from that point way down the hall all the way over to the surgical unit, I felt it made me feel relaxed. It did relax me. So Dr. Robert Zatorre, I just read this study, actually, he's a researcher at McGill University, explains that a series of sounds, when patterned together, can create a reward system, can form an expectation, and the anticipation of that pattern is what creates tension, like music creates tension. You're listening to a piece of music and it's building and it's building and it's building, and your dopamine receptors are being built up until finally we call it, the tension builds, the denouement happens, and it resolves itself. The note resolves itself. It's because we've been expecting it, and that boost of influx of dopamine just fills our heads with happiness and resolution, and there's your reward. Now, also, these are the same neurochemicals that cocaine chases after, only that cocaine blocks the receptors until the dopamine breaks through and gives that same burst of energy. It happens faster and it doesn't last as long. And of course, we know that that causes addiction. So can music cause addiction as well in a healthy way? Can that be something we can look forward to and use? I don't know. It's a good question. Another story I'm going to share with you, a fellow that had very severe schizophrenia and used to sing in a choral choir after a long diagnosis of psychosis. When he came into the hospital, he began to, he used to sing gospel music, and he would love to write music and, write his own lyrics and of praise. And, but then, and he said the most important thing that he really loved was singing together, and that gave him comfort. But unfortunately, his hallucinations were becoming too disruptive to continue. So I want to talk a little bit about the statement where he says, I just loved singing with people together, singing together, togetherness. The comfort, perhaps, is the oxytocin hormone. Like we said, the music can actually stimulate your oxytocin hormone, which is a hormone that makes us feel social empathy and trust and bring that pleasure of being together. It's a nurturing hormone, and it's produced when we hug or kiss, and we have one of the biggest bursts of hormone of oxytocin when we're singing together. So in the caveman time, say 40,000 years ago, let's say, there was a bone flute discovered in Africa, and researchers actually have surmised that the music preceded language. After hunting and gathering, the family bonds were strengthened by making music together and vocalizing sounds. The family that lived together and stayed together tended to survive longer. So he embraced the treatment in the hospital care. He made music his priority every time that I was there. He spent the whole day. And eventually he did leave the hospital. After about a year, he did leave the hospital. And we heard back later that he did go back to his choral singing pre-pandemic, because this was quite a few years ago. And he's also returned to post-secondary school. So I just love me a success story. So to talk a little bit about improvisation, all right, because improvisation actually offers a creative and nonverbal means of expressing thoughts and feelings, and a lot of what I do is improvisation. In fact, when I form my music groups, they have a beginning and a middle and an end. That is my framework. The beginning is usually a gathering, a unifying, an arrival. Make sure everybody's here in spirit, in body, and we sit and we start. The end will usually have a recap and maybe some feedback and a wrap up. The middle, I always have planned, but I'm going to say that 90% of the, 80%, let's say 80% of the time, the middle never actually works out the way I actually had planned, because you don't know who the person's coming, which person is coming to your group, and you don't know how they're going to behave, and you don't know what kind of group dynamics you're going to have. So that is the improvisation part for me as a therapist, in actually bending and flowing with the dynamics of the group. But when the improvisation starts within the group itself, again, every person is different. One person will participate a great deal, another person not very much. Another person will be very withdrawn. Another person is very disruptive because they want to be heard. They want to be. So we have this whole level of social cues and social behaviors of, turn taking, listening, work together, give someone else a chance, so a lot of the rhythm-based activities, they enhance the cooperation and attention. And, a real sense of well-being can come from doing that. Learning to play an instrument for the first time, as I mentioned before, I have several instruments available to people and I say, well, when are you going to get a chance to play this instrument again? Maybe if you like it, you'll buy one. Many of us, even myself, I don't have a lot of these instruments at home, and I've been so fortunate that our foundation has been so gracious to give us a lot of enhanced patient care, and normally I ask for different types of instruments, so it just piques everybody's interest a little bit. So I know that I've spoken a lot about being together and the opportunities and cohesion and everything in the hospital, but going back to these times of isolation, it's really sometimes difficult to find methods of using music for self-expression. So we have I'm sorry, can you hear that outside my window? I apologize. You okay? Okay, good. There's construction going on outside. All right. So anyway, the other one is there are other methods of using music for self-expression, and that is singing. Singing is a great stimulus for happiness and the dopamine, as I mentioned before, and oxytocin, especially if you're singing together. It gives the biggest burst when the brain is improvising. There are no expectations, and we take more creative risks, and it boosts your self-esteem. Now, the prefrontal cortex is, our decision maker, the brain, kind of sits back and takes a rest, allowing the juices to flow a little bit more freely. So it allows a freedom of expression, a freedom of creativity, and that in itself can add to self-esteem. So listening, a lot of the right now, what we can do is use music for listening, and how does that contribute to focus and attention? Some of the examples of making music part of mental health are the outlet for emotions and for direct attention. I want to share with you now a song, a symphony. Actually, it's a symphony poem. That I'm going to walk you through, and what it is Smetana. Diedrich Smetana, in the 1840s, wrote this song to celebrate his land of Czechoslovakia, and he talks about the river of the Moldau. So I'm going to share with you just the first movement of the Moldau, and I want to just outline it for you right now, so you'll know what to listen for. There are two streams as the river boat starts down its journey of the river. And there's one cold stream and there's one cold stream. It says as they converge, you'll hear the different instruments. The first one is one flute piece. Second one is another flute piece. So you got the image of the river, the rippling water, and the emergence of the river streams. Then listen for the difference in the flutes. There's also a triangle that depicts the tips of the white water as the water gets a little bit more rough and as the boat launches further into the mouth of the river. And as you hear more instruments being added, remember this is only the first of 7 movements. The music will build and take you down a trip down the river to see all what goes on the banks of the river. And it's a whole story if you ever have a chance to listen to it, the Moldau by Diedrich Smetana. So I'll play it for you now. Now it's 1 minute long. Yes, I think we have time. 1 minute. All right, you ready? violins, the little pizzicatos. opening up. So that was only the first movement. So you have an idea of how the music is actually going to build and captivate you and engulf you really as it keeps going. So that is a very active listening exercise that I have everybody listen to. And I cue everybody at the beginning so that they know what to expect. And it actually, the very first time that I presented it was really interesting because I wasn't quite sure how people would react to that music. And my coworker beside me, she just said, wow, I have never seen people so engaged in listening to it, because there was a story and there was a representation of the story through music, without words, without someone talking you through it. It was just sit and listen and take a trip down the River Moldau in Bohemia, as it used to be called. So I'd like to share with you now a little bit more about listening. Listening is a big part of music and wellness. I had a fellow who was on suicide watch. He was new to Canada. He was alone. He was young, isolated from his family. And we would play music together. And most of the time I would play the music for him. And he would just listen. He just wanted to listen. And when he was leaving the unit, he said, "Thank you for helping me focus on the happiness in my life." And it was a touching moment. I never realized that I was helping him. This was early in my beginning years of music therapy. And I just said, you know what, I'm just going to keep playing. I'm just going to keep playing. I'm just going to keep playing and see. As long as he stays here with me, you know, he's getting out of it what he's getting out of it. So when he told me, thank you, and he said, I loved hearing What a Wonderful World. Every day he would ask me, can you play What a Wonderful World? And he said, I'm going to leave. When I leave here, he says, that's the song I'm going to listen to. Anytime that I'm feeling down, he said, thank you for bringing music into my life. Another patient had told me that listening to sad music or depressing music, a lot of times people say, oh no, don't play any depressing music, it's going to make them sadder. Well, he said to me that it helped him express the way he feels. He felt validated. He didn't need his own words because the music filled in. There's so many success stories, and I'm so grateful. I'm so grateful that I've had this chance and this privilege to work with a lot of the folks, and that I feel so touched that they share these deep stories with me. So what is the use? What's the usefulness and helpfulness of music for mental wellness, right? I mean, it does provide a quick reach therapy. And one of those quick reach therapies are playlists, using playlists for when you have a need for something, you know. A lot of our patients would journal. They would journal and write, and sometimes turn it into music themselves. You know, it can also be a meditative process of breathing and just sitting with ourselves and listening to a piece of music. It just makes us, again, here and now, keeps us focused on the present. And patients have told me that they'll make songs that, song lists that create a song that have a melody that kind of is catchy, and they'll just find themselves humming to it or singing it to themselves. One patient I had a real gift of words. He was just so gifted in the area of lyrics. He could play the piano and the guitar, having taken no lessons at all. And he could rap, just throw those words out there. I mean, I find rapping an incredible art, because you just have to think so fast and get those words to rhyme and make sense, you know. He was good at it. He was great. But he would get stuck. He was always a line. He would say, you don't know how I feel. You don't know how I feel. You don't know how I feel. And he would repeat it over and over again. And at one point, because I was keeping the rhythm for him on the guitar, I said, no, I don't. I don't know how you feel. So tell me, write it down. And that in itself, he started adding those lines into his rap. And eventually I said, more, because he was kind of getting into it. He was starting to tell me about his life on his tribal lands, the alcoholism in his family and all around him, and how he felt never heard or seen, and then eventually slipping into the same cycle. I wish I could repeat the words and the phrasing that he used, but he was so freeform and so quick, and I didn't record it. But I just emphasized how important it was for him to write it down. Write them down, don't forget. And he showed me his journal book when he left, and I did notice that there was a few extra pages, but so he was also very grateful, just to take that notebook home with him. So all of these techniques, all of these abilities to use music as a coping strategy. But how good is it if we don't notice our triggers? We need to notice our triggers. We need self-awareness and insightfulness to our needs. A lot of group discussions. This is where we're getting close to discharge at the point with our patients. Is that so how are we going to use all these interventions that we've worked on? How are you going to know when you need insight? You need it in the moment. And we all know that when you're in that time of crisis and panic, it's sometimes hard to reach for the very thing that's going to help you. And a lot of folks say, I don't know. Many of the answers I get are don't know. So when we are in crisis, so much of the time is we spend time developing the playlists, and I get them to label them, and then let's put some of these songs down, write them on paper. So when you get your device, because they don't normally have devices here on this unit, let's label them. We've got relaxation, we got tears, we got mood boost, mobility, action, favorites, like all the different labels that we have. They're useful. We're not feeling like ourselves, but just finding the right song sometimes when we're in that peak of the anxiety can actually raise the anxiety even more when you can't find the very thing that you want to help you. So how can we regulate ourselves enough to have that presence of mind to reach for that music medicine toolbox of a playlist that we created? So that is a question that I'm trying to work on. So other research has shown that now there's a lot of nature sounds. Nature sounds can calm the fight or flight response. Exploring sounds like binaural beats, such as spa music, singing bowls, metal tongue drums, all of which are available on YouTube, and many of which have access to, but many people do not. And I just want to point out that a good number of folks that come into this hospital live in a very marginalized area of town. And to have access to these devices is sometimes short-lived due to homelessness, loss, theft. So how do we get everyone connected? I know I'm speaking of my population, but in the general population, if we have the access, we can create a self-care kit. And now I just want to point out that while music can help ease anxiety, depression, and other mental health challenges, it can also trigger unwanted memories, which, if left alone to deal with, can have a detrimental effect. Conversely, its power is when skillfully used by a trained and certified music therapist for the safe and effective treatment, can avoid and circumvent these harmful experiences. So how do we use our music? How do we use our toolkit? Well, I think one of the best ways in general, and we've been talking about care and taking care of ourselves in these difficult times, is scheduling our music for our care. And just like brushing your teeth, getting dressed, bathing, self-care is most effective when you schedule it into your normal day. Try sitting for 5 minutes and use that music to ground you. Take notice of yourself. Be present with yourself now. Envision yourself how your day is going to go. And sometimes when those adversities happen, perhaps you may not need to react to them as strongly as you may normally. So music does also interact with other modalities like artwork or movement, or like I mentioned, journal writing, and it can have the powerful experiences indeed. And I hope that this talk has offered some insight into the powerful use of music and for improved health and wellness. So right now, I would like to just give you a little example of a relaxation session that I do. I mentioned some of the instruments that you can purchase for yourself, and I'd like to show you this one right here this is what I call a tongue drum. All right, so it's metal and it has a big hole on the bottom. So it has a lot of beautiful resonance. This one is the baby of the family, but they can get very large, probably as large as that drum up there, and they're used a lot in meditation, or I use this one. If you're familiar with music, it's a pentatonic scale. So the pentatonic scale allows you to play and never make any mistakes. So a lot of the patients after I've done the relaxation will tell me, can I try it? Of course you can. Yes, because everyone is set up for success. So I'm going to just give you, I know that we're probably heading towards our end here, so I will give you 2 minutes. I was planning a longer time, but I'll give you a couple of minutes of an example of relaxation. So what I'd like everybody to do is just close your eyes, sit back in your chair, just get comfortable, and breathe naturally. Okay, breathe naturally in and out, and in and out. Just notice the air as it enters through your nose. How do your lungs feel as you hold it there for just one moment? Feel your feet planted on the ground. Does the sound resonate through your body in any way? Take a deep breath in, and as you breathe out, open your eyes and join us again here in our group. And I want to thank everybody today for being part of this talk, and I hope you have enjoyed it. And I may also add that you may have just been part of a music therapy session. Thank you very much.